All right. So today what we're going to be doing is introducing the skeleton. Okay, so we'll be talking about the bones of the body, which we organize into kind of two categories. Okay, the axial skeleton obviously is one of those two. It's what we see here in blue in our two figures. Okay, the blue bones are what make up the axial skeleton. Okay, the legs and arms and the girdles, as they're called, are what we call parts of what we know as the appendicular skeleton, which is what your next lecture's on. I went ahead and made copies of that note packet. They're up here by Morgan if you want to grab one on your way out. We'll probably get to that Wednesday or maybe Friday if we don't move that fast. But later on this week, we'll be getting to it. Today, it's all about axial, those bones that were shown there in blue on the previous page. Okay, so reading through, the adult human skeleton consists of 206 named bones. Okay, key phrases there. Adult human skeleton. So this is, by the time you're in your 20s to 30s, once all bones are fused together, and named bones. Now, you guys are going to learn about all of these various bones. Does that mean you're going to learn 206 different names? No. Okay. For a good majority of them, they are paired. Okay. You don't have, a right arm bone that's different from the left arm bone. Okay. Your upper arm is the humerus on both sides. Femur is the upper leg bone on both sides. So for a lot of these, you're not having to know two different things. Okay. Now, there are some singular bones like, your forehead that we'll talk about today. Your frontal bone, there's only one of those. So it's not like there's 103 named bones because not all of them are in pairs. And why it says there in that first sentence, adult human skeletons, because in infants and children, we have more than 206 bones because as we get older, some of those bones fuse together and form, a singular bone. Like your tailbone, for example, starts off as separated bones. As we get older, they fuse together. Okay, the two principal divisions of our skeleton, axial skeleton, consist of bones that lie around what we call the longitudinal axis of the body. Longitudinal axis of our body is an imaginary vertical line. So if you pretend that it runs vertically up and down, straight through our body center of gravity, so right through the middle of our body, from our head to the space between the feet. This includes the skull bones, your auditory ossicles, which fancy words for your inner ear bones, or middle ear, I guess I should say, hyoid bone in your throat, the 24 ribs, your sternum or breastbone, and bones of your vertebral column. Okay. For some of those, like your ribs, for example, there's not a different name for each rib. Okay, we classify them into kind of categories, so that's kind of their names. Or like rib 1 would be its name. Lumbar vertebrae number 1, lumbar vertebrae number 5. They don't have like specific real, like true names. So that 206 named bones really is kind of deceiving, as I've already kind of said. That constitutes 80 of our 206. The rest, the 126 remaining, are part of the appendicular skeleton, which are bones of our upper and lower limbs, or also known as extremities or appendages, so our arms and legs, plus the bones forming what we call the girdles that connect the limbs to the axial skeleton. Down here at the bottom, the table, not something I'm going to ask you to know, but as we go through, you'll learn them, where they belong, that kind of stuff. So you will learn this, I'm not going to focus on it. It's nice because it organizes it and gives you an idea what we'll be looking at. Okay, so last time we met on Friday, we talked about two bone shapes, long bones and flat bones, and we looked at their kind of internal anatomy. Those aren't the only types of bones based on shape that we have in our body. We've also got short bones, irregular bones that really just have no distinctive shape, sesamoid, and then not named for a shape, but their location are sutural bones. Okay, so long bones, as we know, are noticeably longer than they are wide, have a shaft, which we call the diaphysis. The two ends are the epiphyses. And these are the rigid levers that are acted upon by skeletal muscles to produce body movements, which is why you find them making up your appendicular skeleton. So things like your femur, which we know is our thigh bone, both legs, that is. The humerus, which I already said today, is your upper arm. You might know where your phalanges are? Fingers and toes, good. What about your tibia? You might know where that's at? It's your lower leg, that's your shin bone. Okay, big, strong lower leg bone. Short bones, roughly cube-shaped, nearly equal in length and width, generally have limited motion and merely glide across one another. Consist of spongy bone except for the surface, which has a thin layer of compact bone. What are your carpals? Wrists, very good. What are your tarsals? Those are your ankles. Flat bones, these are the other type that we talked about the other day, generally thin, composed of two nearly parallel plates of compact tissue, enclosing a thick layer of spongy bone. They're generally broad and thin with a flattened and often curved surface, which makes them great for protecting or increasing ability for muscle attachment. Sternum is your breastplate. Ribs, we all know what ribs are. What about your scapula? Your shoulder blade. And then irregular bones have complex shapes, cannot be grouped into any of the previous categories. Vary in the amount of spongy and compact bone present, include your vertebrae, facial bones. Anybody know what your calcaneus is? It's your heel bone. Sesamoid bones develop in certain tendons due to considerable friction, tension, and physical stress. The numbers of these vary in size and number from person to person and are not always completely ossified, typically measuring only a few millimeters in diameter. So that's why when we go back to that first page, it says 206 named bones. We all have more than 206 bones in our body. Okay? Some of them are just so small that we really don't give them a special name or anything like that. Okay? Function of sesamoid bones is to protect tendons from excess wear and tear. They often change the direction of the pull of a tendon, which improves the mechanical advantage of a joint. For most sesamoid bones, like I said, we don't even give them a name. But there is one that we will talk about, your patella, which we commonly just call our kneecap, which is found attached within the quadriceps femoris tendon. And sutural bones are small bones that are found only in the skull within what we call sutures, which are the joints that hold our skull bones together and are named based on their location, not their shape, because sutures are not a shape, they're a structure. They vary greatly in number from person to person as well. So we all have quite a few bones, more than the 206, but we don't really worry too much about that. Figure at the bottom, just kind of showing you the comparison on the 5 types with the exception of sutural, which is not shown. Not an important image by any means. So don't worry about it. All right, let's start with the skull, also known as cranium, which consists of 22 bones grouped into 2 categories, 8 cranials that form our cranial cavity. Remember, the cranial cavity is a space, in this case, that protects our brain, encloses the brain. Between these bones and our brain are connective tissues called meninges that we'll talk about when we talk about the brain. So these guys have essentially direct contact with the brain, either kind of, resting the base of the brain on top, or, enclosing it up above or on the sides. It includes a singular frontal bone, that's your forehead, two parietal bones, which form a big portion of the top of our skull, two temporals on the side, occipital in the back, sphenoid, which is kind of a hard one to describe, and it's in our eye socket, but more so it forms a big portion of the cranial floor, along with the bone that's right in the kind of inner part of our nose, which is called the ethmoid that we'll talk about. Which you can also see is a little bit of our eye socket as well. Our facial bones, these have no contact whatsoever with the skull, or excuse me, with the brain. Instead, they form our face, hence the name facial. Includes the two nasals, two maxilla, which are your upper jaw bones, two zygomatics, which are your cheeks. In your eye socket, you have two tiny little, what we call lacrimal bones, singular mandible. You can't see, but inside your mouth, the roof of your mouth is formed by two palatines. Inside your nose, you've got a vomer, which helps separate the nose into the two sides. These two kind of hook-like structures called inferior nasal conchae, which are also facial bones. And that should be all of them. Okay. These bones of our skull are held together by sutures, which are immovable joints. We've already talked about, found only between skull bones, holding our skull bones together. And then we'll talk about a few of those here in a couple slides. Over on the right is an illustration of a fetal skull, baby skull, to illustrate fontanelles, which are membrane-covered spots where bone formation is not yet complete between the cranial bones of a fetus and infant skull, and their function is to enable the fetal skull to modify its size and shape so it passes through the birth canal and to permit rapid growth of the brain during infancy. It doesn't take very long before those kind of go away, but a fetal skull is very, very pliable for that reason, which is why sometimes babies are born with kind of misshapen heads. My nephews look like little alien babies when they were born because they were pretty cone-headed, but they're fine now. All right, before we move on to start talking about the bones one by one, I want to talk about the cranial cavity a little bit more, and our skull, which we can talk about what we call the calvaria, or the skull cap. So this is the top of your cranial cavity, forms the roof and the walls. Okay, so it's like the hat that sits on top. Okay, the base or cranial floor is divided into three fossa, which fossa was one of those terms that was in that final table from our last lecture. Fossa is a depression, in this case to correspond to the contour of the inferior surface of our brain. There's an anterior, a middle, and a posterior. And that's what we can see here at the bottom of the page with the superior view and the lateral view. Lateral view is pretty straightforward. We all know our face, where you can see the teeth and the nose, the eyes. That's always anterior. So the anterior cranial fossa is this depression here. Opposite that's the posterior, and then in the middle is obviously the middle. Okay. This illustration over here on the left side is a superior view looking down at the floor of our cranial cavity. What we've done is we've popped the top of the skull off, and we're looking down into that. It's a little more tricky to tell what's front and back, anterior, posterior. So I always tell students to find this big hole, and I use the term big hole because that's actually what the term foramen magnum, which is what it really is called, translates to mean. Okay, foramen magnum means big hole. That's the hole where your spinal cord goes as it runs down from the base of the brain. That's always posterior, so know that this depression is posterior cranial fossa. This one has to be the anterior, and then the middle is obviously the middle. Make sure you know those three fossa in the two images. these two images up in the middle of the page are not going to be something I'm going to worry about you knowing. Because what we're going to do, starting here on this next page, is going through and identifying and coloring them in along with features associated with them. Oh my gosh, too far. Okay. What we're going to look at on this page is the singular frontal bone. It forms a good portion of our forehead and the top of our skull cap. And then the majority of our skull cap formed by the two parietal bones. Aside from just identifying the bones, you're going to also have to be able to identify these various features. So what I will do, you guys are more than welcome to join along, is go through and color and then identify, which is where I will kind of start some stuff. Starting with the frontal bone, which I will color orange. And we've got 4 images to look at. Starting here, notice it says at the top there in parentheses letter C. That corresponds to the letter C in these images. I'm not the world's best colorer, and that's fine. I'm just typically doing it to be quick. Like so. And our anterior view. Here's our lateral view. And then we've got a mid-sagittal view, which means we've cut the skull in half from front to back. So you can see like this, and we're looking from the inside out. And then from above, okay, I'm going to go ahead and color the parietal bones as well, color those yellow. As I said, they form a good portion of our cranial walls and really the majority of the cranial roof, or skull cap, as we call it, kelp area. Okay, so on your exam, you will have to be able to identify those as the frontal and the parietal bones. But more so, what you're going to have to identify are those surface features, which include for the frontal bone, what we call the glabella, the frontal sinuses, I should say, because there's 2 of them, and supraorbital foramen. So what I do now is I will draw in when needed, or I will just star if it's already labeled, beginning with the structure called the glabella, which you can see labeled here in our lateral view. And I'll draw a dot to it. It's not labeled in our frontal view. If you kind of look or just feel, you can feel a lot of these things placed right between your eyebrows, unless you have one eyebrow, and where the unibrow would be. You feel that little projection, that's called the glabella. Okay. Speaking of your eyebrows, right there by where your eyebrows would be is a supraorbital foramen on each side. A foramen is a hole through a bone, in this case through the frontal bone. Supra for superior, orbital because orbit is a fancy word for your eye sockets. So supraorbital refers to just above the eye socket. A hole in this case allows for passage of nerve, artery, and vein. And supra for superior. Now, the only reason I included this image on the bottom was to show, and I'm going to darken it in, a pocket within our frontal bone called the frontal sinus. We have two of these, which is why up at the top it says frontal sinuses. You ever get sinus pressure just like right above your eyebrows, right in your forehead? Okay, those sinuses are lined with mucus and are connected to our nasal cavity, and when you get like cold, those can kind of get clogged up and pressure builds up, and it might feel like somebody's just pushing in on your forehead. That would be the frontal sinuses. We can only see one because we only have half the head there. Okay, the next structures are the special name sutures. These are the only sutures that you're going to have to know a special name for. Which includes the coronal suture, which is what divides our parietal bones from the frontal. Okay, we can see them very nicely, or see it, I should say, nicely from above. And if you wanted to, you could draw an arrow over here to our mid-sagittal view, but I'm not going to. It's not a big deal. Sagittal suture is only visible here in our superior view. You guys remember the sagittal plane was that vertical plane that ran front to back. Sagittal suture runs right along that plane. Since it runs on that plane, that's where that name comes from. The next suture is called the lambdoid, or lambdoidal as it states. I don't know why, so I will draw it in. It's not labeled above. It's what separates our parietal from the occipital. And then the final suture is this suture right here, which is not labeled, so I will label it for you. Your squamous suture. If you can't read my writing, squamous is one of those that you had to write down already. Squamous or squamous. All right, and then finally, I'm going to darken them in a little bit. These are not super pronounced, but they are there, and they are important, what we call our temporal lines. Temporal lines, can't read my writing. That's written. They are a site of attachment for your, what we call temporalis muscle. Temporalis muscle, if you feel on your side of your skull, right there like your temporal region is, as we call it, take a bite. You can feel that muscle contracting. Very important muscle that connects right there on our mandible so that we can chew. Okay, so make sure you know these things for your exam. Questions on anything on this page? All right. Let's talk temporal bones. Okay, a lot going on with this bone, or set of bones, I should say. There are two of them. Let's go with this nice kind of aqua color. Okay, letter D is the bone in our images. What we're looking at here is just to zoom in on that lateral view. So if I go back to this page, it's this view, but we're kind of looking just right in this area there. Okay, just so we can see some of those smaller structures a little bit more in detail. As you can see, this bone forms kind of the side of our skull, very associated with our ears in that area. Okay, but it also wraps underneath to form a portion of the cranial floor, which is why I include this image, which is the skull upside down. So you've taken the skull off the neck, flipped it upside down. What we've done is remove the lower jaw, so this is the upper roof of your mouth. Okay. So looking at it, coloring this bone. Like so, and then here again we can see from the inside out. Okay, let's start with what we call the squamous part of the bone, which forms the temporal region, is relatively flat and vertical. You remember that's the squamous suture we just talked about. So this area is the squamous portion. Okay. First thing I want to talk about is this thing called the zygomatic process. Zygomatic process is this kind of like bridge. If you look over here, that's what we can see right there, and that's why I call it a bridge. Connects our temporal bone, and it's called the zygomatic process because letter J is the zygomatic bone. If you run your fingers or finger from like that little flap in front of your ear towards your eyes, you can feel that bridge, okay, called the zygomatic process. Now, if I zoom in tremendously here, right here, you can see there's a connection between our temporal bone and the mandible. Okay, there's a little depression, darkening it in. Okay, it's actually visible over here, but it's not labeled, so I'm not going to worry about it. We call that the mandibular fossa, but that's important because along with the mandible, our temporal bone helps form what's called a temporal mandibular joint. TMJ, for short, is the only movable joint in our skull, and it's what allows us to chomp our teeth and move our jaw up and down. It's a hinge joint. We'll talk more about that here later on in this unit. Now, our next structure is part of the tympanic part. Anytime you see the word tympanic, you just know that's the ear. Okay. Speaking of the ear, and I'm going to darken it in because it's an opening, is your external auditory or acoustic, as it's also known as meatus. Here's your ear hole, the external ear hole. Okay. It opens up to the ear canal, what we call the external auditory canal. And this is what you stick your Q-tip in when you clean your ears. Hanging down kind of from that is a styloid process, a little hook. You can actually see them right there, and all the way down here at the bottom. But I'm only going to start right here. Styloid process is a very important site of muscle attachment. For example, a muscle that helps move our tongue around attaches to that styloid process. Okay, and behind your ear, the big bump hanging down, much more of a bump than a point or a hook like the styloid, is the mastoid process. You put your finger right behind your earlobe, you'll feel that roughened, rounded knob. Mastoid process is where a muscle called the sternocleidomastoid connects. Some neck muscle that runs down and connects to our sternum and clavicle. There's actually inside of this bump little tiny pockets, air spaces that connect to our middle ear. We call those mastoid air cells. Mastoid air cells. You can't see them, so I'm not going to worry about you identifying them. Last thing I want to talk about, so the last couple things belong to what we call the petrous part. Best seen as part of the cranial floor. To help separate the middle and posterior cranial fossa. We can see there are some holes within this bone, which include what we call the carotid foramen or carotid canal. I'm going to blacken them in so you can see them nicely. Your internal carotid artery is an artery on both sides that travels up from our neck and feeds our brain. And it travels into the cranial cavity through this hole, or these holes, I should say, because there's two of them. We've also got, I'm going to darken them in, but I'm not going to label them since they aren't labeled already. I won't worry about that. Just behind there is your jugular foramen on each side. This is where the internal jugular vein comes down from our brain, because that's the main brain or vessel that drains blood after it's fed our brain. Okay. And then over here, which is already labeled for you, as I did it, I'll darken it in a little bit, is the internal auditory meatus, not to confuse with the external. This hole allows for the nerve that carries impulses from our ear to connect to our brain. It travels through this hole. We'll actually see a picture of it because we have a picture of our ear internally to show off the ear bones later in this lecture. Okay, any questions on your temporal bones? All right, moving on. Let's talk occipital and sphenoid. All right, your occipital bone, I'm going to color this baby blue color. Letter A is going to form the rear of our skull and much of the base. Very visible here in our lateral view. Also visible in our mid-sagittal view. Now, the mid-sagittal view is really not so much shown for our occipital bone as for the other bone that we'll talk about. Kind of the same. Well, definitely the same for our anterior view because we can't see it at all. That's okay. This far right image on the bottom is one that I'm focused on a lot on this page. For the occipital bone, that is. All right, we'll go ahead and identify stuff associated with it first, and then we'll move on to the sphenoid. First thing I want to identify is that structure I earlier called a big hole. Visible there and there. This is, once again, the entry point for the spinal cord into the cranial cavity. Okay. On both sides of it, here in our inferior view, kind of outlining them, our occipital condyles kind of look like a kidney bean in shape. The term condyle is something that we'll talk a lot more about in the appendicular skeleton lecture. A condyle is kind of a flattened spot where two bones will meet. So we have joints, in other words. This is the point in which our skull and neck bone, the first vertebrae, in other words, meets. So this is where our head rests on our neck. Okay. To help hold our head to our neck, we also have ligaments. Okay. And that includes a ligament that connects to a bump right there in the back of our skull called the external occipital protuberance, which actually is best visible, in my opinion, right here. Abbreviated. External occipital protuberance is a bump that you should all be able to feel in the back of your skull. Attached to that is what we call a nuchal ligament, binds our skull to the vertebral column. Okay, back down to our bottom image here. I'm going to darken in some lines. Inferior and superior nuchal lines. Provide muscle attachment. Okay, and I'll blacken them in so they're more visible. Last structures are the foramen lacerum. Lacerum, I don't know how to pronounce that. Which is actually a pair of holes that's actually shared between this bone, our occipital, but also the sphenoid bone as well. And I guess I would imagine they're visible right here on this page, or on this picture. So I guess I'll highlight them over there. Foramen lacerum, however you pronounce it. All right, our next bone, I always like to describe this as our butterfly bone. You'll see why here in a second, is your sphenoid. This is one of the trickier bones to identify because it's a more internal bone than anything. But that is also visible on the outside from our lateral view, as it does form part of our cranial wall. Here in our mid-sagittal view is where you can see the majority of this bone and its kind of weird features. This bottom left image, this is the floor of our cranial cavity. Really will show you why I call it the butterfly bone. least I hope it does. Looks like a butterfly, doesn't it? We might have to be a little imaginative, but it does, I promise. Letter F in our eye socket is your sphenoid bone as well. So there's a lot going on with this bone. And it is also visible over here. I will color it, but it's not really the most important thing, color. Not the reason I included it on this page, but that's okay. Okay, features of this, and a big reason why I call it the butterfly bone is it's got actually wings, greater and lesser wings. You can see these are structures that help form the fossa, those cranial floor depressions that I was talking about. I'm not going to worry about you identifying those in the images. I do want you to know, and the reason I include this mid-sagittal view is your sphenoidal or sphenoid sinus, which is a pretty good pocket of mucous membrane connection to your nose. Okay, to kind of pinpoint that, if you were to draw kind of a line right between your eyes and another one like right in front of your ears where that would intersect, which is like almost like right in the middle of your head, that's where that essentially would be at. And then I guess it's also visible up here. You see this? It almost looks like a little hook that you can make with your hands. That's called the sella turcica. And I'll actually just make it like a box here. The sella turcica is a term that actually translates to mean Turkish saddle. A structure that hangs down from the base of our brain called the pituitary gland fits perfectly right in that little spot. And just hold it in place. There's a lot more going on with that bone that it's just really pretty complicated, and I'm not going to worry about, you know them. Any questions on either of those bones? All right, moving on. Our last cranial bone, so last one associated with the cranial cavity is your ethmoid. Another kind of tricky bone. It's our smallest of the cranial bones that we've covered. And then I'm going to go ahead and talk about two other bones on this page that are facial bones, because they all, along with the vomer, help to form kind of internal parts of our nose. Your nose is actually pretty complicated internally. Okay? We all think about our nose and the kind of cartilage that we can wiggle around and that kind of stuff. And you also got up towards your eyes the nasal bones. Okay, right there between your eyes, the hard part of your nose. Okay, but our external nose is a lot simpler than our internal nose. Okay. We've got some parts to help form what we call a nasal septum. Okay, the nasal septum is that wall that separates the two sides from one another. Okay, if you think of like in cartoons, you see bulls that have their nose pierced. They got the ring hanging down. Okay, the front of your nasal septum is cartilage. But if you go internally, there are two bones that help form the wall. That nasal septum is what a lot of times actually is damaged when somebody breaks their nose. A lot of times they don't break their nasal bones, they break the nasal septum. Anybody ever heard the term deviated septum? A deviated septum is where it's, pushed off to one or the other side and can cause, snoring and that kind of stuff. Okay. Your vomer, actually I'm going to color the vomer first. And I'll color it peach. Forms the inferior half of that nasal septum. And is the reason why I included this image here from our medial view is that bone there. Okay, at the bottom in our frontal view, we can see the internal part of the nose. Zoom in here for us. We can see that wall separating our nasal cavity onto the two sides. Everybody watch as I color because it's super, super small. That's it for your vomer. Just that little segment right there. Very small, pretty minuscule bone. Right, over here where I've got a picture, this is from your textbook, we can kind of see it. What we've done is basically cut the front of the face off. I know it's kind of, there it goes. You can see very small bone, very thin, and you can see why it could get damaged pretty easily when someone breaks their nose. Let's color. I'm going to go back to the ethmoid and color it green. Your mid-sagittal view will show that it also helps to form that nasal septum, the superior portion of it. We can see, and I talked about this already, it's a cranial bone, so it helps form the cranial cavity. There's where it helps to form the cranial floor. Very small, but it does, connect to our brain. Here's where it's also found inside your nose. So there's where it forms the upper part of the nasal septum. If you look here, you can also see some hook-like structures. The top one that you can see on each side is the ethmoid bone. And your ethmoid also is involved with our eye socket. Okay, since it's 9:50, what I'm going to do is stop here. We will talk about the structures associated with the ethmoid on Wednesday, and then we'll color the inferior nasal concave along with that at that point.